Hey, LeeAnn here and
Carly.
yes, and we are HD Dental Coaching Team and we are recording today from the fabulous BC.
FAQ Friday.
Sure is.
Fabulous FAQ Friday. I love these Fridays.
Ah, it's so nice. It's so nice. So Carly,
Yes.
I have a good FAQ for you.
Lay it on me.
We get asked this quite often from the business desk and dentists as well.
Okay.
And here it is. One question we get asked is, when do you do confirmation calls? How often? When do we do them? Why do we do them? That's the question.
Okay.
How often in the week do you do them? A day in advance, 2 days, whatever. What's the recommendation?
Excellent. I have an answer for that.
Good.
Yeah.
I knew you would. This is your area of expertise.
This is, yes. My question back is always, what is our goal? When we're making outbound calls, whether it's confirmation calls, treatment calls, hygiene calls, what is the goal? And the goal is to get the patient in the clinic, get the patient in the chair. If the patient's not in the chair, then we can't help them save their teeth. We can't help them save their teeth. We can't help them live a longer, better life. So the goal is always to get the patients in the chair. There's no easy answer for this, but something that I always like is having an automated confirmation system.
Yeah, that is helpful.
It's very, very helpful because it gives the patient a little bit of ownership in it as well. You can set it up to remind them 2 weeks in advance. And if that patient is a good patient, they don't need more reminders. They'll confirm that appointment. And that's the only reminder that they're going to get. They're not going to get another one. But then you have the patients who need a reminder called 2 weeks in advance, a week in advance, 2 days, 1 day, when they're in their car, when they're in their parking lot.
That's me. Right? I'm a bad patient.
So a system like an automated system, there are tons out there. And anyone who wants a recommendation on one, I'd be happy for you to send us a message, and I'd be happy to refer you to a few different companies. Those patients, they'll get the reminder calls that they want.
And that they need. It's not necessarily that they're bad patients. They're just not...
they might have a million things on the go.
They have too many things in their brain. They have too many things in their brain, so we just have to help them.
So always remember, the goal is for any outbound call is to get the patient in the clinic. That's the only way that you're going to be able to help them save their teeth. And
if you are doing phone calls yourself, then it's also, there's language around it. So language to not make it so easy for them to cancel on you.
Yeah.
So
some verbiage and some scripts. And I do use scripts loosely. You by no means want to be reading off a piece of paper, but there's keywords that you can be using. And I definitely recommend practicing the calls as well, doing role playing so that you get used to using those words and get comfortable, and there's heart behind it.
Yeah. And that you actually, that's true. I love that there's heart behind it, because like the goal is to better our patient's life with their oral health. The mouth is the portal to the body. And so we do want them to remember this and keep their bodies as healthy as they can be, especially in crazy, weird times. So
that's right.
Yeah.
Yeah.
So great.
Awesome. And you know what, if you are having trouble with, keeping your schedule full, you have lots of gaps and holes, lots of short notices, you know what, send us a message. Yeah. We'd love to work with you. We'd love to help you with the verbiage and the scripts and do role playing with your team as well. That's always a fun time.
You can't assume everybody, knows what they need to know. It's about training and giving your team all the right
tools and information.
Yeah, tools is the right word I was looking for, so that they can be amazing for you and on fire. You want to build yourself an ace team. So
that's right.
We'd be happy to help you with that.
Reach out to us, send us a message, join our Facebook group, and as always, join us for our FAQ Fridays, and send us your questions as well. We'd love to hear from you.
We would love to hear from you. So from Kelowna, it's LeeAnn saying so long.
And Carly, have a nice weekend.
I got you on that one. Okay, bye y'all. Thanks.